the ICD-10 initial encounter versus subsequent. The question is, if a patient had an injury and went to the ER for an initial treatment, had sutures, when they came to our office for suture removal, would they be an initial encounter, as it is the first time in our office with this diagnosis, or would it be subsequent? Well, I kind of went out on steroids and gave you a lot of additional information on this, but because the answer is actually simple. So I added some extra stuff on there. So, of course, I had to give you a picture of some sutures, and I was very nice and only did a simple one. The answer to the question is, for ICD-10, and I just picked a particular laceration, was S, 51.811D, laceration without foreign body of right forearm, subsequent encounter. The reason this is classified as a subsequent encounter when you go from having something done in an ER and then they come to you, it's because initial and subsequent doesn't follow the like CPT, it follows the procedure itself. So, and the actual injury. So the first time it was treated is always the initial encounter, and then after that it's always a subsequent encounter until it moves on to something else like a sequela. So it's not how many times the patient is necessarily seen, it's how many times this particular diagnosis is used. So think of it that way. Now, in addition, the CPT gets a little confusing with this as well, so I wanted to explain some information that I found on that. It's a new patient range is going to be 99201 through 99203, and an established patient range is going to be 99211 through 99215, and all of that's determined on the documentation. So let's look at some information that you need to be aware of when you're looking at the documentation, some of the stuff that you're going to want to abstract. So for diagnosis, there is a code, and I gave you the ICD-10 and the ICD-9, encounter for removal of sutures. This is not a code that can be used as a first listed diagnosis. So that S code that we used earlier would be your first diagnosis, subsequent encounter, and then you would use this Z code for the reason they're there, to have the sutures removed. In addition, I was told that in some cases that Z09, encounter for follow-up examination after completed treatment for conditions other than malignant neoplasm. This does not translate or convert from 9 to 10 as well, because in ICD-9 it's V67.09 that a lot of people will use, and it's a follow-up exam following other surgery, whereas Z09 is much more specific. But remember that this is healed without more treatment. So that S with the backslash, that's the medical abbreviation for without. So again, this code would be there's no more treatment. Then you want to know, did the provider evaluate for an infection, healing, arrhythmia, or edema? And this is something that is probably going to be done when they come in to have their sutures removed, just to make sure that the wound is looking okay, not just having those stitches pulled out. They're doing an assessment while they do that as well. So as we scroll down, we're going to see some more things that you want to keep in mind. Wound care instructions given and noted in a chart for a provider, that's classified as part of that E&M as well. Were diagnosis, prognosis, or risk discussed? Again, did the patient ask, is this going to scar? Am I going to have problems with scarring? Maybe if there is, the laceration is maybe in the fingers or something, is this going to make it to where I have difficulty moving my fingers, or it's still real tender? How long before I'll be able to type again? Things like that. And or that's all healed, but it's still kind of pink in there. Could I get an infection still? Those are things that if they're addressed, that's part of the NM. Now, keep in mind though that no modifier is going to be used like a 54 or a 55. Those are not used in this situation. 54 surgical care only, 55 post-operative management only. So don't get confused. And sometimes in testing they'll throw those in there and they don't apply. So another code to be aware of is 99024. Post-operative follow-up visit can be used, but it's not a code that Medicare or commercial insurances are going to pay. And so a lot of times they will use this in-house as a code to just keep track of these suture removals or things that's not getting paid out for. So overall, if you look at all of this, this is probably what you could expect to see in a scenario where a patient came in to have sutures removed after an ER visit, and that would be 99212 for your visit, S51.811D for subsequent encounter, and then Z48.0T or 2, excuse me, and that's the statement that the reason they're here is to have their sutures removed. So again, the answer is it's a subsequent encounter, and hopefully that'll give you some more information on what you can look for in the encounter to justify your 99212. That's a good one. I like ICD-10.
Do you need more medical certification training? Go to www.cco.us. And don't forget to subscribe to our YouTube channel for updates.